This is Cindy Manginelli with the National Healthcare for the Homeless Council. In conjunction with the Bureau of TennCare, we are providing this training on TennCare and healthcare for the uninsured. I'm a TennCare Shelter Enrollment Project Coordinator at the National Healthcare for the Homeless Council. And so what we do in our project is we travel across the state of Tennessee and we visit programs, individuals, ministries that serve those who are experiencing homelessness. And we assist families and individuals in enrolling in TennCare and receiving the benefits of TennCare. And then we also help those who are not eligible for TennCare to find healthcare or to find assistance with their healthcare related needs. And so today's training is specifically for those who want to help those who are homeless or for those agencies that provide direct services, and to sort of give you an overview of those who are eligible for TennCare, how you enroll in TennCare, how you get assistance if you need it in obtaining services, and then what you can do if you're not eligible for TennCare, but you do have some healthcare related needs. So my email address is at the end of the presentation. If there's more information that you would like, we do trainings on healthcare and homelessness, sort of the intersection of healthcare and homelessness. We do trainings across the state of Tennessee and even somewhat nationally. And so if there's more information that you would like about homelessness and healthcare or about TennCare, we are happy to be of assistance. Feel free to email me. But we're going to do a little overview here. This is specifically, as I said, for those who provide services to those who are homeless. You can use this at a staff training with interns, as part of your onboarding, whatever would be most helpful to you. You have our permission. Feel free to use it in whatever way would help your staff and those that you work with have a better understanding in a very basic way of TennCare and healthcare for the uninsured. So when we think about offering healthcare or helping those who are living in extreme poverty, helping them find healthcare in the state of Tennessee, there are a few terms that you'll probably hear and a few options that we hear thrown around. The first one is healthcare.gov. And if you do not receive health insurance through your employer, and most people who are experiencing homelessness don't, either because they're not employed or because they have an employer that doesn't offer healthcare benefits, or because they have an employer who offers healthcare, but it's not at a price they can afford. And the industry standard for affordable healthcare would mean that it's the cost of that healthcare coverage is 9% of your income or less. And so it may be that many of our clients are employed, but they either are part-time, and so they're not offered healthcare benefits, or they're seasonal workers, or the healthcare coverage that is offered to them is more than they can afford. And so what most people will do, if that is the case, is they will then go to the marketplace, to healthcare.gov. And this is an election year, and so I've been saying actually for a few years now that this is subject to change, and there have been changes even in the last few years over healthcare.gov and sort of the way TennCare and healthcare.gov work together. But the first place that people would typically go is to healthcare.gov. And there are tax credits and subsidies available on healthcare.gov for those who are poor. However, your income has to be above federal poverty level in order to qualify for assistance on the marketplace. So if your income is below poverty level, you cannot receive assistance on healthcare.gov, and therefore you're probably not going to find a coverage plan that you can afford. So for most of the clients that we work with, healthcare.gov is not a viable option. They can certainly go and apply and check that out, but I have never assisted a client experiencing homelessness who was able to go on healthcare.gov and find a plan that they could afford, or even that they were eligible for, especially though if their income is below poverty level. Medicare is another term that you will hear, and sometimes people confuse Medicare and Medicaid. TennCare is Medicaid for the state of Tennessee. Medicare in general is for those who are over 65 or for those with a disability who've worked at least 40 quarters, and Medicare is measured, your eligibility for Medicare is measured in how much you worked and how long you were gainfully employed. But Medicare is typically going to be for those who are over age 65 or those who have a disability. The safety net is another term that you'll hear kind of thrown around when you're assisting people. The safety net is specifically around mental health. And so if you're working with someone who can't afford health care and who can't afford insurance and they have mental health issues, they have a mental health need, they can go to a mental health facility designed to serve the poor, and they can apply for safety net benefits. And typically, almost always, they will be approved, and safety net will pay for their mental health care. So meds, treatment, therapy, support groups, whatever, based around mental health needs will very often be covered by safety net. But the safety net there typically does not address physical health needs. Cover Kids is another term that you will hear, and Cover Kids is specifically for children. And most of the children that you'll see living in homeless shelters or experiencing homelessness will actually be eligible for TennCare. Cover Kids is for children in a slightly higher income bracket. Sometimes, every now and then, we'll see kids who qualify not for TennCare but for Cover Kids. But in general, TennCare is going to be the best healthcare option for especially families experiencing homelessness. And so this just gives you an idea of the 2019 federal poverty guidelines. So when you're thinking, well, who is above or below federal poverty level? This is sort of the standard of federal poverty level. So you can see how many members in the family, then you can go over and see what their income is to see whether or not they are in under federal poverty level. And TennCare is specifically for those who make 250% of federal poverty level or lower. 250% of federal poverty level or lower. So as you can see from this chart, almost all families experiencing homelessness are going to be eligible for TennCare. So who is eligible for TennCare? And this is the non-income based criteria. So if someone is eligible based on their income, then they also need to fall into this criteria. The first thing we would look at is income, and then we need to look at this criteria, because not everyone who makes below 250% of federal poverty level is eligible for TennCare. They also have to fit into one of these categories. Now, there are about 27 different categories of TennCare, but when I'm thinking specifically of those who are experiencing homelessness, these are the ones that most typically are applicable and that we would consider. First of all, they have to have children under the age of 19. They must be caring for children under the age of 19. Those children must be in their custody and must be living with them. They are filing taxes with these children as dependents. These children live with them. And so anyone who is living without children is not eligible for TennCare in general. Again, there are exceptions, but as we look at those who are eligible among the homeless population, in general, if they don't have children in their custody, they're probably not eligible. Now, they can go ahead and apply and find out, and sometimes I encourage clients to apply, and sometimes I'm surprised, but in general, you're looking at families. Pregnant women are eligible for TennCare. Parents and caretaker relatives who have custody of the child, and they must be the primary caretaker. So if someone is raising her grandchildren or his stepchildren or an aunt or an uncle or anyone like that who is the primary caretaker, they have custody of children and they're the primary caretaker, those children live with them, then they are eligible for TennCare even if they did not give birth to those children, even if they're not the parents. Women between the ages of 19 and 64 who have been diagnosed with breast or cervical cancer are eligible for TennCare. It must be a current diagnosis, so they are currently receiving treatment for breast or cervical cancer. No other kinds of cancer, just those two, and only women in those age brackets. And while they are receiving treatment for those two kinds of cancer, they will receive full coverage and they are eligible for TennCare. And then you must be legally present in the country. You must be, an undocumented individual is not going to be eligible for TennCare. Now, if an undocumented individual has children who were born in the country who are legally present, then those children are eligible for TennCare even if the parents are not. So how does someone apply for TennCare? And this is the part that's actually changed. The process of enrolling in TennCare has changed several times over the last several years, and it has changed again in the last couple of years, and actually become a process that I think in a lot of ways is much simpler and much more streamlined. You apply for TennCare by going to tenncareconnect.tn.gov. And you see here, this is what the opening screen looks like, or something like this. Obviously, the graphics may be changing, but you can see very clearly a link, apply now or create an account. And it's just that simple. You click on the link and you follow the instructions, and that's how you apply for TennCare. You go to TennCareConnect.tn.gov, you create an account, and you apply. If you're working with someone who has successfully created, say, a Facebook account, then they will probably be able to successfully create a TennCare Connect account. It is a similar process. You have to have an email address, you have to put in your email address and then verify using your email account. You have to create a password, and there'll be security questions, and then you just have to have the ability to put in your basic information. So if you're working with someone that you feel confident would not have the ability to create an email address or to create a Facebook account, then they are probably going to struggle with creating a TennCare Connect account, and they're probably going to need assistance. You can apply over the phone, and you'll see those phone numbers on the same website, and you can apply by mail. I'll be honest and say, as I've walked clients through the process of applying by mail, I found that to be fairly inconsistent, and to be honest, I've had very few clients who successfully applied by mail. They were never contacted. We had to make several calls to follow up, and it just seemed like their information never gets to the right person. And so it is much more reliable to apply by phone or to apply online, and I have certainly found the online process to be the most reliable. It takes probably about 30 minutes. If you have a client who has complicated income information or complicated immigration information, then it can take longer. Most of the clients that I work with don't have a lot of income information, and so we can skip that entire section. But those two steps can certainly make it take longer. As you sit down to complete that process, your client will need their own birthday and the birthday of everyone that they're applying for, so all their children, their spouse, anyone that they file taxes, anyone that they file as part of their household when they file taxes. They need birthdays for all of those people, social security numbers for all those people. You don't have to have the actual birth certificate, and you don't have to have the actual social security card. However, you do have to have the social security number and the name of each individual as it appears on their social security card, as it appears when you file your taxes. What's the number you put down when you file your taxes for those individuals, and how do you write their name? And then you will need the income for all family members in the household. And like I said, if this individual does have income, you may need additional documentation that you have to upload, and that certainly does get a little trickier. You would need some sort of scanner or some way of uploading that, and that's where you may actually require a little more assistance. The site does offer assistance. You can ask for help, you can email, you can chat, and so the site is designed to offer assistance, but that may be a little bit trickier if you're working with someone who's not extremely computer literate. You are required to have an email address, and so if I'm working with a client who does not have an email address, we just go ahead and create an account using an email carrier that's free. We just do that, and then I write out the password for them, and I write out the account, and they will need to check that email account from time to time as they'll receive reminders and updates from TennCareConnect.gov. You can on TennCare Connect, you can specify that you only want to receive reminders by mail. And so you don't have to maintain an email presence after you've applied. You can just stay up to date by mail. There's also an app associated with TennCare Connect. And so if you download the app, then you can certainly use that, and that's very easy to do. But if you're working with a client who doesn't have an email address, they're probably going to struggle to use an app as well. And then you have to have a mailing address, and this does not have to be a home address. If your client is able to receive mail at someone else's home, that does not disturb the application process at all. If 2 or 3 families are receiving mail from TennCare all at the same address, that's fine. TennCare does not regulate to make sure that each individual client has a separate address. So if they get their mail at a local feeding center or a clothing closet or a church, that's fine. It does not have to be their home address, which comes in really handy with this population. Sometimes I work with people who really stress and say, well, what will we do if they're homeless? Obviously, they don't have a mailing address. And I just encourage people to ask their client, how do you normally get your mail? Most homeless people do have a way of getting mail. Most of them receive their EBT card and notifications about, food stamps. And so ask them, how do you normally get your mail, and see if they can do this the same way. Typically, once you complete the application process online, approval is received immediately. Sometimes right away, you'll get a pop-up that says you've been approved, or within a couple of weeks. Sometimes the program will say, we need more information, or we're going to take a little time to process your claim. But typically, it's very thorough, and you should be given a phone number or an email address where you can contact people if you don't hear back in a timely manner. And then the insurance cards, if you were found to be eligible for TennCare, are just mailed to you, typically within 2 weeks. They are allowed to take up to 90 days. All of this process is supposed to be completed within 90 days. And so if you apply and you don't hear anything back, then keep following up, then call, then ask, because this is supposed to be a 90-day process. And there are times when I've worked with clients who received a pop-up immediately and received their cards within a week. And then I've worked with clients where it was significantly more complicated, especially if there's immigration issues or income issues, if the person's just gotten out of incarceration, things like that. Sometimes it can take longer. So stick with it. And let us know, or let some similar agency know if you're not hearing anything back. So important reminders regarding TennCare. TennCare is not an insurance company. And so I very often talk to clients, and you may talk to clients, and when I say, what insurance do you have? They say, I have TennCare. But TennCare is not an insurance company. And so when they receive their cards, it's going to be really important that they make note of who is their MCO, or their managed care organization. That is their insurance company, and that will be clearly stated on the card. It may be Blue Cross Blue Shield, it may be Amerigroup, it may be United, but it's not going to be TennCare. And so it's important that they realize that they become very familiar with the numbers and the information provided on their card, and that they know the name of their insurance company. All patients who receive TennCare are assigned a primary care provider. And so a lot of people don't realize this. They think, okay, now I've got TennCare, I can go to any doctor and it'll be covered. And of course, we know, for those of us who've had to navigate the insurance world, that is not the case. And so I encourage clients, when they receive their insurance card, it's going to come with a big packet of information that honestly most of the clients I work with find to be really intimidating. To call the number on their card and to ask, who is my primary care provider? Who is my child's primary care provider? Who is covered under this TennCare? Is it just my children? Is it all my children and me and my spouse? To call and get that very basic information and make sure that they know who's covered and that they know which hospitals they can go to and which doctors they can go to. There will also be an email address on the card typically, and they can go to that email address. No, I'm sorry, not an email address, a website. They can typically go to the website on the card and also find a list of providers. So if they've been assigned a primary care provider, or if their child has been assigned a primary care provider that they don't prefer, that can be changed. They just have to they call the number on the card, they can go to the website and get that changed. Very often they can call their preferred provider and say, hey, I was assigned a primary care provider by TennCare and I would like you to be my primary care provider. And very often that provider can give them paperwork to fill out. So all of that's flexible typically and can be changed, but clients need to know to do that so that they don't end up going to a provider and then it turns out it wasn't their preferred provider and they end up having to pay a lot of money because they didn't know that they had to go through a process. TennCare is complete coverage for children: vision, dental, behavioral health, substance abuse treatment. It covers everything for children. For adults, it can be a little different, but it can be comprehensive care. So I encourage, when I'm working with families, I encourage them, go get your well child visits, get their eyes checked, get their teeth checked. If teachers have encouraged you to get a behavioral health assessment, all that's covered. Make sure that you find out who you should go to and that you're going to the right providers, but now you're covered. So get those things done and don't be afraid to use the coverage. There are a lot of barriers that people experiencing homelessness face when they go to get medical care. And this training is not about that. We offer trainings on that, on just sort of healthcare for homeless people, 101 kind of thing, and we can certainly do that if that's something that would be helpful to you. But just be aware, there are a lot of different reasons why people who are experiencing homelessness, and specifically families that are experiencing homelessness, there are a lot of reasons why homeless families really struggle to get medical care. And so it's important to be aware of that. And this at least is addressing some barriers that you can kind of tackle right away. We're going to get you signed up for coverage. We're going to figure out who your provider is, and we're going to make the appointments, and we're going to just knock down these hurdles one after the other and get you the care that you need. That's not going to address all the barriers that they face, but certainly the biggest ones, right? So if you were denied, if you applied, you found the website, you clicked create an account, you create an account, you clicked apply, you applied, and you were denied. Maybe you were denied instantly, or maybe you received information in the mail or by email a few weeks later saying that you were denied. Why was I denied? So let's talk about some very common issues that people experiencing homelessness face when they're trying to get TennCare, and some very common reasons why they are denied. First of all, I work with a lot of clients who move from another state and they come to Tennessee and they immediately apply for TennCare, and they're denied because they still have Medicaid in another state. You can only have Medicaid in one state at a time. So when clients come from another state, they need to immediately cancel their Medicaid in the state of origin, the state they came from. That's very important. It's important to realize that most states are allowed to take up to 90 days to cancel a policy. And then, as I said earlier, most states are allowed to take up to 90 days to get someone enrolled. And so that means if you have someone come to your shelter or come to your program and they've just had a baby, or they're pregnant, or they're sick, they have a chronic health condition, they could potentially go 6 months without coverage while they wait for their coverage to get canceled in one state and reinstated in Tennessee. And so that needs to be a top priority. So a lot of families don't realize that you've got to get it canceled in one state before you can be eligible for TennCare. Secondly, custody issues. If a family has just recently regained custody of their child, maybe they just came out of incarceration, maybe they just came out of a treatment center, or for whatever reason, they've just regained custody of their child, sometimes they'll be denied because the person who had custody of their child previously was receiving TennCare as the primary caregiver of that child, and that's not been changed in the system. So you can't have two groups of adults who are claiming to be the primary caregiver of a child at the same time. And so you just have to call and explain that, and you may have to show documentation, but that sometimes is tricky for people experiencing homelessness who may have frequently lost custody, or custody's been back and forth, for whatever reason. That's something you'll have to call and explain. Domestic violence issues sometimes make it complicated for families to get TennCare. So I've worked with families where the abusive spouse filed their taxes and correctly filed that they had this significant income, but now the other spouse and the children are living in a shelter. They don't have access to any of those funds. They're living in poverty, but according to their tax filing status, that's not reflected on their tax filing status. And so again, this has to be a phone call. You're going to have to, there's nowhere to put that in on TennCare Connect. There's not going to be anything to click on that. You're going to have to call and talk to someone and explain, yes, I know that my taxes look like I have a lot of resources, but in reality, I don't have access to those resources. What can I do? And so another issue that many people experiencing homelessness face is confusion around taxes. And so what will very often happen is that you may have one parent who has some of the children and another parent who has some of the children, but either they all file together, or sometimes I've worked with moms and they said, well, I let the dad claim this child on their taxes. We've got 6 children together and I claimed 3 and he claimed 3, even though he has no custody of the child and he never sees the child, because that way he could get, money back. He could get a better refund or whatever. And so then when that parent goes to apply for TennCare, TennCare doesn't recognize her as the primary caregiver because that child is not on her taxes, is not claimed as a dependent on her taxes. And so that's going to be, and so the only parent who can apply for that child is the dad, who claims him as a dependent but doesn't ever see him. So sometimes we have parents who do things like that, and that's going to make it impossible or much more complicated for them to get TennCare, and they're going to have to fix that or ask the other parent to apply before that child's going to be eligible for TennCare. And then lastly, another big issue that we see is when we have unaccompanied youth. So we have children usually teenagers who've run away from home or they've been kicked out of the home and now they don't have an adult to apply for TennCare with them. If you are under 18, you have to have the birthday, name, social security information of an adult in order to apply for TennCare. You are eligible. TennCare or children are eligible for TennCare, but you can't apply without an adult. And so we just brainstorm with the minor around this. How did you get food stamps? How did you get your driver's license? How did you enroll in school? For children, for unaccompanied youth, and again, this is a whole nother training and a big topic, they have to have an adult's name, birthday, and social security number to do almost anything. And so they typically have that. And so you just have to brainstorm with that young person around how can we get you that, what adult is willing to step into that role for you just long enough for you to get TennCare. And of course, even once they go to use their TennCare, they're going to need an adult in order to seek medical care for almost anything. So that's going to be an ongoing problem that they'll need to think about. So if you have families that you're serving who have TennCare, even if they've had it for 20 years, they need to create an account. Everyone who currently has TennCare needs to create an account. They need to go to tenncareconnect.tennessee.gov and create an account, because this is TennCare's primary way now of monitoring those who have TennCare, of sending them updates, of managing their contact information, of maintaining the correct address. Very, very important. Anyone you work with who has TennCare, make sure they've created an account. They can also download the app. But like I said, even if they're not real computer savvy, this is something that they need to go ahead and do and make sure that TennCare has their correct information. So you may have heard a lot in the news about thousands and thousands of people who have lost their TennCare coverage. And many of the homeless families that we work with are among those. I work with many, many, many clients who go to pick up their child's prescription and suddenly find out that while they've had TennCare for 10 years, now they don't. And so that's a big issue that homeless families are facing right now, which is why I encourage all those who come into your program at intake, ask them, do you have TennCare? How do you know? Have you called the number on your card? Have you been in contact with anyone recently? Because a lot of people have lost their coverage, and we don't want someone to get to the emergency room and suddenly realize they don't have TennCare anymore. That's going to make that a lot harder. Most of the people that I work with who have lost coverage, they've lost it because of the renewal process. And just like with EBT or food stamps or many government benefits, people who applied for TennCare were told all along that they would have to renew every year. But for many years, TennCare did not actually engage in a renewal process. And so there was no way for them to renew, and it was sort of a moot point. However, in the last few years, TennCare has reestablished that renewal process. And most families were given the opportunity to renew through a packet that they received in the mail. And so it was sent to a mailing address. It's a fairly large packet. It has a barcode on it, so it is specific to individuals. And so families experiencing homelessness who had not updated their contact information did not receive the renewal packet and therefore did not complete it and lost coverage. I also worked with a lot of families who received the packet but didn't understand what they should do with it, or they completed it incorrectly, or they didn't complete it for every family member, and so they were dropped. And so that's why a lot of families that we work with have currently are losing coverage or have lost coverage. So what do we do if you're working with a family and they've lost coverage? First of all, they can apply again. There's a 90-day period between the time that TennCare tells you that you're going to lose your coverage and the time that you actually lose it. So sometimes I work with clients and they're in that 90-day period and they know that, and they just need to do exactly what TennCare tells them to do and they'll be reinstated. Most families that I work with have no idea whether they're in that 90-day window. And so I just encourage families to go ahead, and if they have not been given specific instructions by TennCare, to apply again. TennCare Connect, go to the website and just apply. Create an account and just apply. And then TennCare will be able to tell you what to do. You can also appeal. If you lost your coverage and you tried again and for whatever reason they told you, no, you're not eligible because of the renewal process, you can appeal. And the appeal, the first few steps in the appeal process don't require going to court, don't require going to a judge. It's not as intimidating as it sounds. Again, TennCare Connect, contact someone via the site, use the links provided, and they'll be able to walk you through that process. Most importantly, I tell families, I've worked with a lot of families who've gotten really discouraged through this, and they've just said, forget it. And so they're going without their medication, they're going without doctor visits, and so I really encourage families, don't do that. More than likely, you are eligible if you're a homeless family in the state of Tennessee. Keep jumping through the hoops, and your coverage will be reinstated if you're unless for some reason they've told you specifically why you're not eligible. So let's go back to that. So if you go through all this and it's just we're still not getting anywhere, feel free to contact us. There are other agencies like the Tennessee Justice Center who specifically help people who are eligible for TennCare receive it. So, and we're happy to help with this as well. We're happy to advocate for you. We're happy to help you walk through this process. So if you look at this and you're working with someone and you realize they are absolutely eligible for TennCare, but they keep getting dropped somehow, we're happy to help. Now, what about those that you work with who are not eligible, those who do not have children, those who have children but they don't have custody of those children? What can they do? And so these are just some basic ideas of brainstorming ideas of things that you can do. First of all, as I said, it doesn't hurt to apply. It doesn't hurt for people to go to TennCare Connect and go ahead and try and just make sure that they're not eligible. There are special categories of TennCare for people who have enormous unpaid medical debt, things like that, people with disabilities. There's a lot of different categories around that. So go ahead and apply and make sure that you're not eligible for TennCare. Then across the state of Tennessee, there are many clinics specifically designed for those who don't qualify for insurance. And so we call them sliding scale clinics. There are faith-based clinics. There are clinics for the uninsured. And so what most of those clinics will do is someone will come in and fill out paperwork, and they will be charged based on their income on a sliding scale. And so they may pay significantly less than they would at a clinic for the insured. And in fact, most of our clients who are not eligible for insurance cannot be seen at a clinic for the insured. So we encourage them to look for those clinics specifically designed for people who are not eligible for insurance. And as I said, there are many across the state of Tennessee. This is a website that TennCare encourages people to go to, www.needymeds.org. And at this website, you can put in your zip code and they will give you a list of clinics in your area for the uninsured. Also, they'll give you a list of specifically vision centers, dental centers, all kinds of different providers specifically for those who don't have insurance. So this is a very valuable resource, and honestly, this is one of the first places I go when I'm sitting down with someone who has a medical need but doesn't qualify for TennCare. And then there are many hospitals that have indigent care programs. If a hospital is receiving government funds, then it is required to help people regardless of their ability to pay. And so most hospitals, not all, but many hospitals do have what's typically called an indigent care program. And typically, clients have to apply for that. You can almost always, if you look hard enough, find information about those programs on the hospital's website. If not, you can call. Very often the application for their indigent care program is on their website. And so there may be paperwork that you have to complete. Some hospitals even require that patients take a meet with a financial counselor or take a financial counseling course before they receive indigent care. So there may be some hoops to jump through, but many hospitals will provide services to people even if they're not able to pay. And so that's worth checking into. We talked about safety net, specifically of a client with mental health issues, filling out an application for safety net. And then I have had clients with severe mental health issues who, because they applied for safety net, were also able to receive assistance with their physical health issues, either because the clinic that they were visiting for their mental health issues also had doctors there who addressed physical health needs, and so it was kind of all under one umbrella, or for whatever reason, that is definitely worth a try. And then sometimes, and this may be a bit of a long shot, but sometimes when I'm working with someone who has a chronic illness, we have reached out to disease-specific foundations and found assistance. For example, the Epilepsy Foundation. I've worked with clients who were not eligible for health care, We couldn't find a program that would apply to them, but we reached out to the Epilepsy Foundation and they were able to help. They were aware of resources that we were not. And so if you've got a client with a very specific medical condition, sometimes you can find programs that will help. And so that's certainly a good thing to try. That's a hard issue, when you're working with someone who's not eligible for Medicaid or for Medicare. And so sometimes you really have to think outside the box and figure out what can we do. And in many parts of Tennessee, I find that I just really have to direct that individual to one of the larger cities like Nashville, Memphis, Knoxville, Chattanooga, maybe Johnson City. But we really have to go to a bigger city to find help sometimes when I'm in rural locations. And I hope this training has been helpful to you. Again, this was just sort of a very, very basic introduction to TennCare and to healthcare for those who are homeless in the state of Tennessee. We are here to help. So if you're working with a client or a friend or a family member who's experiencing homelessness or living in extreme poverty and you're not sure how to help them address their health issues, we are happy to help. My email address is here. Also, we do provide a wide variety of trainings at sort of the intersection of homelessness and healthcare. We provide training on assisting someone in a mental health emergency, suicide and homelessness, severe mental illness and homelessness, safety planning with those who are homeless, domestic violence. We have a whole host of topics that we provide trainings on. And so if that's something that would be helpful to you or to your agency or to your ministry, feel free to email me and we would be happy to come out and provide a training for you and help you feel better equipped to serve those in our community who are experiencing homelessness.